My name is Petra Tegman, and I'm working for Swedish Care International, and I'm here today representing Queen Sylvia Nursing Award, where we will have an interview with Mr. Jörg Veil from Home Instead, Germany. Very nice to have you here, and welcome.
Yeah, thank you for having me, Petra Tegman. My name is Jörg Veil, as you stated. I'm the founder and general manager of Home Instead Senior Care here in Germany, and I'm happy to talk to you today.
It's an honor to meet you, as I mentioned. We would love to hear more about your background, your career, and all about Home Instead Germany, how it started and how it's going at the moment. Could you please just start by telling us a bit about yourself and your background?
Yes, sure. I'm not from the care industry originally. I'm not a nurse or a doctor. I'm a business person. I studied business administration and did my master in the US many years ago, and started as an employed manager with different German companies back in Germany in the 90s. And at the end of at the age of 39, I was getting interested to run my own business. And at that point in time, I've been looking at the German market. I've been looking at several franchise opportunities from franchise systems from other countries who were looking for a master franchisee to start their operation in Germany. And I've been at a master conference, I think that must have been 12 or 13 years ago, where I learned about Home Instead. Home Instead is a provider of senior care at home. Has been already at that time the biggest non-medical home care company worldwide. And as I mentioned, they've been looking for a business partner in Germany who's going to set up the German operation as a master franchisee. And I've been looking at the market at that time. I learned about the types of services, which I'm sure we will talk about later. And I understood that this is a new model for the German market, which differs from the usual way home care has been provided here in Germany at that time. And I liked the services and decided to learn more about it, get in touch with the Americans, visit Home Instead in Omaha, where they are based, and finally both sides decided to go into that partnership. So I started Home Instead in 2008 here in Germany.
So in what way, you mentioned that it differs from what Germany was used to. In what way do you think it differs? What is the big difference between Home Instead and the traditional home care in Germany?
Mm-hmm. Yeah, traditional home care, there are two big differences. Traditional home care is done on a task-oriented base with minute-wise visits of only 5 minutes, 10 minutes, on average maybe 15 minutes. And they are focused on medical care and on providing personal care by nurses who have maybe 10, 15, mostly seniors on a shift, driving around with these small cars you might also have in Sweden, stopping before a house, jumping in, providing the care for a couple of minutes, and then going back to the car and driving on to the next client. That's the way home health agencies, home care companies are still providing care in Germany. I would say 99%, maybe 95 to 99% are still doing business in that matter. Home Instead is quite different. We are providing care on, first of all, only non-medical care. And our visits are not minute-wise provided. We are usually with the client for a couple of hours a day, starting from 2 hours minimum up to whatever is needed, if necessary, 24/7, which is rarely the case because it's quite expensive. The other difference is we provide the care not with nurses usually, but with what we call caregivers who are not trained as a nurse because they do not provide medical care. They provide only home helpers, relationship type care, and would go shopping with the senior or for the senior, help in the household, would just talk with the senior, and provide also, in many cases, respite care and dementia care. And the average time with a client per week is probably something in between 5 and 10 hours. So it's much more time intensive than the usual type of medical care home care companies provide.
And that is so interesting to hear, because to me, I think a lot of countries, Sweden also has what you talk about, the traditional one in Germany. We have it minute-based. For example, we have 5 visits a day, and they could be 20 minutes each. And there's a list of things that should be done during those 20 minutes. And the same one caregiver could have between 10 to 15 visits a day, which is a huge difference. What happened in Germany when you came with the home instead way of looking at home care? What was the impression, and was it difficult to get this through in government or insurance companies, or what way does it work?
Yeah, we do have a contract with the German care insurance system. We had it from the beginning, 2008. But it has not been working perfectly with the system back then. I had to talk to government and also talk to the insurance companies to make a couple of changes. We had to introduce the possibility to invoice by time, by minutes or hours, rather than by tasks, which has been usual at that point in time. And we also had to lobby for companionship being part of care insurance as well. Back then, care insurance has only been paying for providing personal care and home helpers, and not companionship. Companionship type of care, which is possible now for many years, but I had to talk to government officials. They have been learning about the system from the US mainly, but also has been running in a couple of other European countries already. And once we got that through, our model was working much better, and we then started with the rollout of the system in Germany. So I started with just one office in Cologne, where I'm based, and we were nowadays close to 140 offices in Germany, providing care to, you didn't ask that question yet, but I'm pretty sure you would, providing care to currently more than 40,000 clients. Wow. With almost 10,000 people on staff in the independent offices. And if you look at the number of seniors or clients we served from the beginning in Germany, we just hit the mark of 100,000 clients.
Yeah, that was actually going to be my next question, because to me, this sounds like, I can only assume that you must be, if not the biggest, but one of the biggest care providers for home care in Germany, because this sounds like what everybody wants.
Yeah, that is true. Germany has more than 14,000 home care companies in place, and the market is split in 2 parts, I would say. One is the big welfare companies like Caritas from the Catholic Church or Diakonie from the Protestant Church. they combined have a market share with some other welfare organizations of probably a little over 50%. The other close to 50% is private care providers. And we are actually the biggest private home care provider in Germany for 2-3 years now. Although our market share is only somewhere in between 1 and 2% right now.
Oh, wow. Mm.
So the market is huge, 40,000 people we provide care to. Sounds a lot, but it's only a small portion of the market yet. But we are still by far the biggest private home care provider in Germany.
Well, Germany is a big country.
Yes, true.
Well, you mentioned those 10,000 employees. What are the benefits for the caregivers that work for Home Instead compared to other home care companies?
A caregiver who's working with Home Instead, I would say 90% of those didn't work in the care industry before.
Oh,
They,
really?
and that's true for the caregivers providing the service at the client. It's not true for office staff. I'll talk about office staff later. If we talk about the caregivers providing the care at the senior's home, it is more than 90% people who have been either working in a different type of job before, mostly part-time. They could have been working in the retail industry, or maybe in a restaurant. Then they read about our job offering, and they read that they need to help seniors. It's non-medical. It's not necessary that they have a certain certification or training before. They just need to have the heart on the right spot, and we train them, and they are able to provide care to seniors even if they didn't do that before. The other group is caregivers who did senior care on a private basis within their family, have been family caregivers, or maybe even caregivers who did that on a professional basis, privately, offering their service within the community. And if you ask why would they prefer to work for Home Instead, they get a training. We for sure offer them the client base which fits for their needs in the right part of town at the time they are available, and we are able, since we have the license with the German care insurance, we are able to invoice the care insurance as a private caregiver would not be able to invoice the care insurance directly. In that case, a private caregiver would need to get paid by the senior, and the senior would get money from the insurance, which is only 40% of the money a certified home care provider can bill the insurance. So there are a couple of advantages for caregivers working with Home Instead. If you're talking about nurses and especially certified care managers, that is a little different. We do have probably around 500, 600 nurses on staff, mainly care managers, who have a certificate, and they work in the office, but they also go out to new clients, talk to the families, set up the service, introduce the caregiver, and do the quality insurance visits, which are necessary by our Home Instead standards and German care insurance as well. So a care manager who's working for Home Instead, why do they join us and not work for other home care companies? Or they might have worked for home care companies before, the traditional ones, and now decided to come to Home Instead. What's the major reason? Well, it's the type of service we provide. We have as much time for the client as the client wants and is able to pay for. we don't have the stress for the care manager of organizing these minute-wise visits. The stress level is much lower, and a usual nurse, home care company would usually is asked if they can stay longer, because the seniors usually have more need, and they would like to see the nurse in their home for another hour or two, and they always need to say, no, I have to rush, need to go to the next client, I don't have time. We don't have that with Home Instead, and I think that's what nurses, especially care managers, really enjoy. But they also enjoy having a regular working week from Monday to Friday, weekend free, no night shifts, and also no stress with medical care, which carries a higher risk for a care manager, rather than only providing companionship care and home helpers.
Well, to me, it is quite obvious, but if you would like to emphasize, why should a client choose Home Instead instead of another traditional home care provider in Germany? What is most beneficial with choosing Home Instead?
I think it's always a question what the client wants and needs. If the client's need, and mainly it's the family deciding for many of those clients. If the family thinks we need help 7 days a week in the morning, getting up from bed, and getting started in the day, and again before going to bed in the evening, that's usually a visit of 15-20 minutes. And for these type of services, a traditional home care company would be the right choice. We would tell the clients we have a different model. We would stay 2 hours minimum and do much more than just getting somebody out from bed and dressing and maybe help with the breakfast. We would spend much more time. And if the need is coming more from the family caregiver who says, let's take a dementia client who's at home and usually cannot be at home without that family caregiver. The family caregiver needs to care for that dementia family member 24 hours, 7 days a week. This family caregiver really needs some time off. That's what we call respite care. And for the family caregiver, it's much better if they would have maybe only 3 visits a week of Home Instead with, let's say, 3 hours per visit, because they then have 3 times a week, 3 hours off their stressful job. Hopefully more than that, because other family members also help, but Home Instead would help maybe 9 hours in my example 9 hours a week. And care insurance is paying for it, German care insurance. And by the way, if they not decide to use Home Instead, the budgets of the German care insurance might even they're not used, and the budget ends at the end of the year. So there's a tendency, due to that legislation, there's a tendency that these respite care budgets are really used because people need time off from their stressful task.
Yeah, which is definitely a stressful task, as you mentioned. I can only imagine getting like 3 hours off. That would make a big difference for a caregiver at home or a family member that stays at home.
Yeah. What I tend to say is, if you have a traditional home care company helping and coming in 7 days a week, in the morning, in the evening, for 15 minutes, the family caregiver cannot even leave the house, because they cannot get a long way in 15 minutes if they need to be back home again. In our case, we could do both. We can offer the family caregiver that we leave the house with the senior, and the family caregiver can stay at home, do whatever they want in that time, or more often the family caregiver leaves the house for a couple of hours, and we stay at home with the dementia client, and that really helps. These just 3 visits a week. Believe me, the family caregiver is looking for those days and times to come, because they really need some time out.
Yeah, for sure. You mentioned also, like the previous or some companies that still perform the more task-oriented care, and you talk a lot about how you work more for relationship-based care or person-centered care. Can you give us like the picture of what is that to home instead? What is relation-based care?
Mm-hmm. Starts with the caregiver, really. A traditional home care company would send 7 days a week, maybe 2 visits a day, would send probably 4, 5, maybe even 6 different caregivers, or let's say nurses, during that time. With Home Instead, usually we only have one face to the client, so it's just one caregiver providing care to that senior. Over the week, the caregiver usually has maybe 2, maybe 3 or 4 clients to visit, not more. But if you look at it from the point of view of the family, they only have that one caregiver. What we do offer, if the caregiver is sick or the caregiver goes on vacation, we do offer an alternative. Most of the time, or many times, the family says, no, I'm going to wait 2 weeks until whatever the name is back, which actually we don't really, it's not our choice, because we would like to continue the service for sure, rather than stopping for 2 weeks, but that's more the business side of actually. Yep.
Yeah. Well, we talked a bit about dementia patient also. Do you provide special training for your caregivers in dementia care?
Yes, starting for a special training for the nurses, for the care managers, because, and that was been surprising for me many years back when I learned that. As business person, I had to learn that a nurse, at least in Germany, is not trained on dementia care in their basic training in the first 2 years or 3 years. I was really surprised to hear that, but that is still the case. So we cannot. It's not right to say a nurse or a care manager knows dementia care. So we have to start with those. We need to train the care managers on dementia care. So that's what we do first, and then the care manager would train the caregivers in an office on dementia care. That's a specific training program. We do train maybe 25 to 40% of our caregivers, because not every caregiver is willing and also able to provide dementia care. So we do only train those caregivers who we think are the right ones to provide care also for dementia clients in stage 2 and 3. And it's a training program with 9 steps. So it takes several courses until a caregiver is really trained on dementia care with Home Instead, according to the Home Instead training standards, which are, by the way, not German training standards. It's Home Instead International caregiver training.
Okay, so they have one that you can use from America, or it's like standard?
Yes, correct. We need to, for sure, translate and then adapt according to legislation in the country. But we do train, I would say, 80-90% the same content as in the US or UK or other countries where we are operating. Not in Sweden yet, but I do know that the Americans are looking at Sweden, also Norway and Denmark, and are willing and interested to enter these Scandinavian markets. We are interested, or I have to say the American colleagues are interested to enter Sweden. So yeah, if you know anybody,
Yeah.
I would know who to contact in the US.
That sounds very interesting. I am just curious. I started my career before I started to become a nurse. I started my career in home care, and I
Mhm.
remember that the Swedish system is quite stressful. It is short visits. You have many visits during every day, and it is a bit stressful. And you always got the feeling that it's not person-centered care. It's always task-oriented. So
Yeah.
I'm a bit curious about how did you convince the German authorities or the system that this is what is needed? Because I can totally see how beneficial it would be even in Sweden for our elderly, of course. But do you have any tips, any suggestions on how to approach the government here?
Um, how to approach the government in Sweden? Huh. Yeah, that's an interesting point. It's probably necessary to um, to talk about the systems in other countries, and bringing examples from US, from UK, and maybe also from Germany, where the system is running already quite successful. Um, Also, we do have a white paper, a study in place, where the relationship-based care is compared to task-oriented care, and explains why it's more useful, at least in certain cases, and 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 as a study also shows data. So that white paper might be a good possibility to approach the Swedish government.
Mm. Do you have any thoughts or any suggestions of what kind of a person would do well with spearheading home instead in Sweden?
Uh, the connection was not perfect. You ask about a person who would start home instead in Sweden.
Yeah, what kind of abilities or what kind of knowledge
Mhm.
or experience do you think it is
Yeah.
needed?
If I look at my international franchise partner colleagues in the various home instead countries, and we do operate in 13 countries. On I think it's 14 now with Singapore, 14
Mm,
countries on 4 continents. It is mostly, probably only, it's business people,
mm,
because it's about setting up a a business and a franchise operation. Um, it's not it's not really necessary to have a background in the care industry. Home Instead US in that case would support with all you would need to start the business, starting with operations manual, training materials, marketing materials. The job of a international franchise partner, in that case in Sweden, would be to adapt all this to the Swedish market, and the job would be to also, yeah, um, inform about and advertise the system, and to talk to government and maybe insurance companies, how the different business model would fit into the social system, into the care system of the country, and
mm,
do some lobbying to get the changes which are necessary, that the model really works in Sweden. So
mm,
it's as I mentioned, it's not necessary that that person has to have a care background in the care industry. It could be a business person who likes the model and enjoys to get it started in the country.
mm,
Management experience, I think, is important,
mm,
um, but also um, be the right person for that type of industry. I
mm,
don't think you can uh, jump into that industry if you're not if you don't have the right personal
mm,
attitudes.
mm,
Social industry, the care industry is quite specific industry. I enjoy working in it now for 12, 13 years,
mm.
but I don't think it's the right fit for everybody.
No. It's true. And I can only imagine you need some kind of entrepreneur heart and ability
Yes.
to be able
Yeah.
to get up and running.
Exactly, and some financial background also, which I'm not
Mm.
going to go in detail now, but
Yeah. Yeah.
investment to start a system like that.
Yeah, for sure. For sure. Well, my heart is with the patient that has or are living with dementia. Are there any specific way you are looking at these kind of the patients living with dementia, or are you doing anything in specific to help them, or to find them, or to support them, or are you also including family members in your care in any way?
Yeah, a dementia client living at home alone is quite difficult. Might be possible for the very first stage.
Mm.
Uh, um, Stage one in dementia might be still possible that the dementia um, uh, client would stay at home alone, only with certain visits of home instead over the week.
Mm.
Mostly our dementia clients are living with a family member. It could be the wife or husband, but also could be living with a son or a daughter, and usually they are taking care of the dementia client for most of the time of the week, and we just provide respite care for a couple of hours a week, up to if needed and necessary, couple of hours every day, which is just a matter of costs and budget. We do train our caregivers in, yeah, not only how to treat a dementia client, also treat more difficult attitudes, but we do train them how to spend the time with a dementia client and what they could do with them, especially or yeah, to give you an example, we would if the family is interested, we would provide a photo album, a
Mm.
booklet where the caregiver would collect material to put into that album. Um, Old pictures, maybe postcards from travel, whatever they can find, together with the client and with the family. And the reason we do that is not to produce an album for the family, which might be interesting later, but to get in contact with the dementia client and talk about things in the past, because that's what they still are able to talk about mainly. Um, they oftentimes have more problem with the near future and still know the old things, and we might listen to old songs with them, um, or do things when once we learn more and more about that dementia client, we for example, if we learn that an old man enjoyed to go to the football stadium, we
Mm.
might do that with him, which he hasn't done for maybe 20 years, and to activate the client is an important thing, and the football stadium is just one example. Could be a travel to a place in the surrounding, and take a walk, what they did many years ago. Um, these are all the things we are trying to learn about the client's past and then use it um, in our caregiving.
Mm. Well, that is a very nice and beautiful summary of relationship-based care, I think.
Mhm.
That is exactly what it is all about, finding out what is important to you, or it has been important to you, and what we can still keep as something for you. That is excellent to hear. So, during these very difficult and special time that has affected us all over the world, is there something you can share with us when it comes to companionship care now, especially during this COVID-19 situation?
Yeah, sure. When COVID started in Germany, and that was in March and April of last year, um, in the first place, we're not really sure how to handle the situation, but I think that was true for every industry and in the entire country, not our country only, but every country in the world affected by COVID. We have been able to get the necessary protection material, as the masks especially, and disinfection for the hands within a couple of weeks, and we only sent homestead caregivers to clients starting last year in April or May with FFP2 masks, which protects not only the caregiver but also the client. That is one standard. I know that some clients don't really want that, especially our dementia clients are irritated by the mask, but we just need to explain it, and especially to the family, that that's necessary to protect them, because usually the client is not wearing a mask in their own home. They would like to be without a mask and not wear a mask when a homestead caregiver is in place. We still provide our services over the COVID crisis, and I think that's also very important. We are providing care to the high risk group of seniors, mostly with serious conditions, and it's better that we are in contact. One caregiver of home instead is in contact with the client, rather than 5 nurses of a traditional home care company. And if you look at especially lonely seniors who are living at home alone, they do not need social contact. And what they also need is they need to go shopping, at least to the supermarket. And it might be better in COVID times that we do the shopping for them rather than they do the shopping themselves. So I think Home Instead is a small piece, or the relationship-based care model in general is a small piece to the to solving the COVID crisis situation for people in need of care who live at home.
Well, is there anything you would like to add, that you would like to share with us?
I can just add or emphasize how important relationship-based care is, especially or also for home care companies. I think it's also important in care homes. But the relationship-based care at home is just a very important service type or service offering, and I would love to see Home Instead get started in Sweden and other Scandinavian countries in the upcoming years, and most likely, if that's going to happen in Sweden, you will not only see Home Instead growing and evolving. There's going to be a new industry sector which started, and we see in Germany now. I mentioned we have 140 offices up and running. We might have at one point in time 200 offices in Germany, covering probably 80-90% of the population. But in the meantime, in the last 10 years, we have seen other care providers, home care providers, who picked up the same business model, also providing relationship-based care. And my estimate is, we don't have numbers on that, my estimate is that we have probably more than 2,000 relationship-based home care companies in Germany by now. And the vision we do have in every country Home Instead enters is, we would like to change the phase of aging by providing a new service offering, relationship-based home care. And Yeah, people can stay home longer, and the family caregivers have more um, more time for themselves, more time out, I could say. It's really beautiful concept, and
Yeah.
I'm just hoping that it's going to start in Sweden in the next couple of years.
So do I. So do I. That is a really nice vision and for care, for home care, and I think that is definitely needed all over the world. Well, thank you very much for that summary.